space. So I'm most interested in how you connect the dots, and particularly how we take all these new forms of data, genome, proteome, microbiome, exposome, sociome, etc., and start to make sense of them and make it useful for the individual, in terms of self-care, and as clinicians, so we can use that for true health, proactive, preventative care rather than the reactive sick care model.
So, and I know that you wrote an article for National Geographics, I believe in 2019, 12 innovations that will revolutionize the future of medicine. So what's your favorite?
It's hard to have a favorite. I mean, I've actually
No favorite
National
children?
National Geographic actually, of course, they retitled 12 innovations that revolutionize the future of medicine. And the point of the article was it's not about any one innovation, but how you kind of combine them together. I think, one of my sort of, favorites now, which is, getting more and more magical, is, augmented, virtual, and extended reality. Now in this realm of spatial computing. So, virtual reality via a VR platform is almost becoming like the equivalent of a syringe. It's a vehicle for doing new forms of therapy. It could be putting on a VR headset for a patient who's got burns, and they can use that to go into a cold virtual environment, throw snowballs at penguins in a platform called Snow World. And it's super effective at managing pain, whether you're a burn patient or going to the dentist. We can use it for clinicians to do training.
Yeah, and what do you think of digital tattoos?
Well, I mean, this is the idea that your skin can be a biomarker for your sweat, for example, this idea of sweatables. And so there's a variety of sort of prototype tattoos, some of which can change color based on your blood sugar. So if you're a type 2 diabetic, for example, it might show if you're low, medium, or high, because you don't necessarily need to know your exact blood sugar. Some purport to be able to maybe even have a bit of a digital screen on them that could communicate instead of having your own, smartphone or other screen. Sweat can again be a biomarker that might be useful if you're running a marathon or if you have renal disease or congestive heart failure. So
a lot of people also have concerns that the digital technology, AI, will pretty soon substitute medical doctors. Any thoughts on that?
Well, there's a famous quote that I and many others have used some version of, that, AI is not going to replace your doctor or physical therapist or pharmacist, but the doctor-pharmacist health system that's using AI will replace those who don't.
Cures, Remedies, and Beyond podcast with Dr. Irina, a Stanford-trained medical doctor, inventor, and a published author with over 30 years of clinical experience, is bringing together the science of medicine and the art of healing for ultimate vitality and health. It engages in discussions with healthcare providers, wellness experts, innovators, philosophers, spiritual and industry leaders, as well as health and wisdom seekers to provide you, the listeners, with practical tips and knowledge to help optimize your health and well-being. The Cures, Remedies, and Beyond podcast with Dr. Irina.
Today, we're discussing innovations and the future of medicine, including recent scientific and technological breakthrough in healthcare and wellness. I feel privileged to have a very special guest whose resume reads like a sci-fi novel turned reality, Dr. Daniel Kraft. Thank you for joining us, Daniel.
An honor to be here.
You're quite well known in Silicon Valley as an inventor, entrepreneur, and a Stanford and Harvard trained medical doctor. You are also a scientist and healthcare innovator with over 25 years of experience in the fields of immunology, oncology, stem cell biology, regenerative medicine, biotechnology, digital health, and medical device innovations. You're also an advisor to several Fortune 500 companies and startups, and you're a prolific speaker, having given 6 TED Talks and TED Med Talks, among many others. What I didn't know is that you served as a flight surgeon in the Air National Guard, practicing aerospace medicine with F-15 and F-16 flight squadrons. And you were a finalist for NASA astronaut selection. What an amazing accomplishment, Daniel. We met a few years ago at a Singularity University event where you served as the faculty chair of medicine. And over past 10 years, you have been the chair and mastermind behind NextMed Health, formerly known as Exponential Medicine, as I understand, a program that explores how rapidly developing technologies can reshape the future of healthcare. You're definitely the most qualified person to discuss this topic, and we would love to hear your insights. So please tell us what's evolved in the last decade and what is coming in diagnostics, preventive care, new treatments.
Well, I think what's coming next is going to hopefully surprise all of us. Sometimes you need the 10-year view to kind of get a perspective on what's changing. I think many of us are familiar with Moore's law. That's the power of computing getting faster and cheaper, which is why my Apple Watch has more memory and power than a crazy supercomputer from the 1990s. But while things sometimes move exponentially, things in innovation sometimes have a bit of a different pattern. There's also something called Amara's law. And sometimes we tend to overestimate or hype what might be here in a couple years, but underestimate what will be here in a decade. And so if we kind of take the 10-year view about what's coming next in healthcare, I think it'll make the last 10 years look really slow, particularly in health and medicine, where sometimes things happen incrementally, not exponentially, but we have huge opportunities to improve, prevention, health span, diagnostics, therapy, global and public health, particularly when we kind of put together fast-moving technologies at their convergence, their super convergence. And so I've been a bit of an accidental futurist. I'm trained in internal medicine, pediatrics, hemonc, et cetera, aerospace medicine. But my favorite thing is to sort of look at where these dots connect and how can we do things better and reimagine different elements of health and medicine. So we can dive into a whole bunch of those elements. But big picture, given that we're still using fax machines and DVD-ROMs and stuck in sort of the old landscape of sick care, we have an opportunity to leverage everything from AI and low-cost genomics to wearable data to the microbiome to the metabolome to new forms of digital devices and digital therapeutics to CRISPR to reshape things across the planet and hopefully make health and medicine much more accessible and equitable, not just available to those of us privileged to live near a tertiary care center.
Right. What I like what you said, from sick care to healthcare, right? So that's a big change in the paradigm, obviously. So, what's most exciting to you related to the future of health and medicine? I mean, what are the biggest breakthroughs that excite you?
I don't think there's any one breakthrough. We're seeing tremendous advancements in gene editing and CRISPR, where the cost of sequencing a genome has gone from $10,000 to $100. It'll be $10 in maybe 10 years or less. Imaging is getting faster and cheaper. We've got now digital health and digital biomarkers from our wearables and our Wi-Fi. We've got new ways to use augmented and virtual reality on our off-the-shelf Oculus Quest or still expensive Apple Vision Pro. We've got new modalities from psychedelics to new forms of gene editing, polygenic risk scores. So I think what's most interesting is now the ability to, I don't know if I made up the term, but multimodal health. It's not going to be just about your labs or your imaging or your medical record, which is often not that useful in its current form because it's made for billing. But we start to layer these things up. We can know about Arena versus Daniel and your base genome, for example. Many of you have been sequenced or had your 23andMe done, for example. But when you combine that with other information, maybe your sociome, where the society you live in, your placeome, or your exposome, where you've lived, adding in things like your metabolomics that you could test on a low-cost continuous glucose monitor, start to build that idea of a bit of a digital twin for each of us or our patient population or society writ large. We can start to take that integration and be much more personalized and proactive and hopefully precise with not just our sick care model and diagnostics and therapy, but even how do we extend people's healthy health span? A lot of people in Silicon Valley want to live forever. Forever is a very long time. But how do you personalize the regimens that might really make sense and aren't moving into snake oil? Because there's a lot of noise out there, particularly in let's say the longevity space. So I'm most interested in how you connect the dots and particularly how we take all these new forms of data, genome, proteome, microbiome, exposome, sociome, et cetera, and start to make sense of them and make it useful for the individual, in terms of self-care and as clinicians, so we can use that for true health, proactive, preventative care rather than the reactive sick care model. And so I envision, where this is getting interesting is of course now layering that with big data and generative AI and LLMs, where that can start to unleash the insights from this. And so if you're seeing a patient in the clinic, you're not just deciding what might be best based on some 10-year-old double-blind placebo-controlled trial on a very narrow population, but one that's really much more based on the patient in front of you, based on even real-time crowdsourced information. So this information age is great. Big data is exciting, but we want to go from big data to knowledge, and knowledge that's applicable to an individual or population, and then narrow the gap, not wait 17 years between it published in New England Journal and it's useful at the bedside of the website. So I'm most excited about connecting the dots of all these new forms of data and information to make it actionable and impactful.
Yeah, that's definitely a good perspective, because we're obviously bombarded by the number of the wearables now and information. So, but how you connect it and how you put it in use is what really matters. So, a lot of people also have concerns that the digital technology, AI, will pretty soon substitute medical doctors. Any thoughts on that?
Well, there's a famous quote that I and many others have used some version of, that, AI is not going to replace your doctor or physical therapist or pharmacist, but the doctor, pharmacist, health system that's using AI will replace those who don't. And, if we look at the big picture, we zoom way out. In the US, let alone many parts of the world, there's a huge shortage of doctors, specialists, nurses, etc. And much of what we do as clinicians today is not at the top of our license. We're doing a lot of triage, or folks are seen too early or too late in the emergency room when they didn't even need to be there, or we're taking up time and clinical resources to manage a standard urinary tract infection or a COVID diagnosis. And so I think the power of AI and new forms blended with telehealth and beyond is to often supplement and be that first layer of triage to start to enable whole new ways of doing care that still need to have clinicians in the loop, but when they're most needed. And so that can free us up to be doing more face-to-face time, that human side of medicine, or enable us to spend more time and attention on guiding diagnostic elements or helping pick the right therapy, whether that's a drug, a device, a digital therapeutic. But clearly the landscape's shifting. I think it can start to democratize healthcare. I'm involved in a startup that's just about to launch in India this summer of 2024, which is going to be sort of a LLM on steroids, doctor in your pocket for the bottom, the very poor population across India, hundreds of millions that have no access to primary care. Now you give them an AI chatbot doctor, or clinician type platform that can triage their headache, their abdominal pain, point them to get the right labs or imaging done if that's needed, because you don't even need a prescription to do that there. Interpret that and help guide them to the best next action. Sometimes that might be a telemedicine visit. Sometimes that's actually go to see the human doctor or a nurse practitioner or a community health worker. So tremendous opportunities to up level and make healthcare more accessible, particularly when we can use it to pick up diseases early and not spend a lot of our time and resources on late stage problems.
Yeah, no, I love that. So it's basically we're augmenting, the doctors' capacity to gather information and help underprivileged communities or areas. Yeah, it's really remarkable what you're doing in India. So you did mention digital twin technology. So would you expand a little bit more? How does it work? And what's in the pipeline now? I know that there is some research actually in the neurological disorders, in relation to the neurodigital technology. But could you tell our listeners a little bit more about that digital twin technology?
Well, I don't think it's a bit of a buzzword, frankly. I mean, it means different things in different settings. Some folks are building digital twins of the heart. Companies like HeartFlow that's spun out of Stanford or clearly can do, AI enhanced MRI based imaging of your coronary blood vessels and your heart function, and give you a picture of your coronary blood vessel blood flow and maybe suggest whether you need a stent or need to be on a statin. That's a bit of a digital model informed by lots of other imaging from thousands of individuals. So you can start to model what's likely to happen to somebody and their risk for a particular event or progression. And that might help personalize your proactive prevention before someone has an event. You can think about big picture digital twin, where again, you know someone's base genome, which by itself isn't so helpful. There's certainly some diseases that are very, single gene monogenic, but many are polygenic, like diabetes and cancers. And when we start to layer that together, and look at an individual based on their labs, which are now expanding between the Chem 20 or Chem 40 that we might use in the clinic today to maybe thousands of protein biomarkers. We can start to look at the pattern of digital proteins that are predictive of a certain disease. And we've seen some recent results out of the UK Biobank that can look at protein biomarkers that can predict Alzheimer's well before it occurs, or Parkinson's, or a long list of other diseases. So that's sort of starting to model, a proteome with maybe other information. And so big picture, I think the idea is that, in medicine today, we're kind of trying often treat the average, and no individual is really average. The average temperature for most of us and our patients is not 98.6. That might be broad average, but when we can start to understand someone's baseline, when we say digital twin, some data and insights are really built on that individual, or maybe a population, you can really start to guide prevention, diagnostics, therapy, and public health in ways that are hopefully much more effective, more early in the progression, and can both save money, lives, and suffering, and bring more health and resiliency to all of us.
Right, yeah, and I like that also there is a capabilities of testing drugs instead of us doctors, giving you one pill and see if it works or not, and how badly, you react to it. So you can do it digitally. So, or, not
Well, one
necessarily
example,
on
I'm an
your.
oncologist by background. Now there's several companies and academic groups making, you biopsy the tumor, you might grow a micro organ, or grow that in the test tube and test it with different chemotherapy agents, and help see which one is most effective. That's a bit of a form of a not exactly a digital twin, but a clone twin, right? Of other folks are taking iPS stem cells from a patient with a known disease and using that to create new drugs or screen for them. So lots of ways to think about, digital is just a term of, digitizing information. That's information needs to be turned into real insights that can drive developing a new drug, developing a new intervention. Again, those don't all need to be a drug. It could be exercise or a form of diet. Thinking about precision nutrition. Lots of fad diets out there, but now we can look at someone's metabolome and their microbiome and their base genome and obviously their weight, and even look at their muscle and fat mass, and really start to hyper personalize those things, and the coaching that goes with it, because we can have all this data and information. It could be from a full body MRI or your genome or your labs, but it's a bit of a so what if it doesn't enable you to sometimes change your behaviors to ameliorate that condition or the risk. And so it's, I think, exciting coming into this new realm is a new ability to do, precision behavior change. That the coach you talk to, whether it's an AI chatbot or a human coach, can know it's arena, and understand that your favorite color is green, mine's blue, and you like badges and I like points, and gamify your proactive prevention or your management of an acute or chronic disease, and sometimes gamify it in a way that
Right.
matches someone and keeps them engaged and on path.
And of course, customization is the future, obviously. So far in medicine, we have been using way too many cookie cutters approach, right? So,
well,
from
including in the drugs,
diagnostic to treatment,
including in
yeah.
the drug side, I've developed a little technology I call it telemedicine. You can watch a TED talk from a few years ago with the idea that not everyone needs the same preventive regimen or therapy for hypertension and heart disease. So instead of taking a pile of 7 or 8 or 10 plus pills and the wrong doses for you, we could sort of 3D print a personalized poly pill. And so
3D printed medication. Okay.
well, a
Tell me
combination
more.
medication.
Yeah,
So
right.
you're not just
That's
taking
great.
aspirin, statin, beta blockers, synthroid, vitamin D, antidepressant,
Yeah.
etc. You might have one that's the right cocktail for you, and eventually be able to print that, on your bathroom sink top, based on your data or your labs or your symptoms from the day. So that might be a future of highly personalized precision medicine. We still want to avoid taking drugs if we can, but some of those might be
Right.
a longevity cocktail, which might be highly personalized for an individual, rapamycin or metformin in the right dose or combination and timing for you based on all your metrics.
Right. And I guess that's where the real value of certain wearables or digital trackers, really coming forth. So, I mean, it's an incredible amount of wearables since when was the release of the Fitbit? Like in 2009 or something like that.
Right.
And since that time, right? So we have incredible amount of um, insidables inside your skin, under wearables, sensors in your underwear, breathables, voiceables, using voice as a biomarker, even measuring outputs like poopables. Is that what we call it now?
Yeah.
Having the sensors in your toilet and measuring the urine and stool analysis. I mean, it's actually quite ingenious in a certain way. So, and then you have right away, as you said, your customized data that your medications will be adjusted to.
Right. I mean, again, it's a bit of a so what. You can have all these. I've got 4 wearables on. I've got my Aura Ring and my Whoop and my Apple Watch, and I have another wearing somewhere else. What is important is how you then. No one wants the raw data. No doctor wants to be presented with a printout of
Exactly.
your EKGs from your watch or your sleep raw data. You want the insights. And a lot of
Right.
these are now, giving you a sleep score, all of which are roughly, I've been comparing them. If I have a bad night's sleep, they all kind of say the same thing, but they're not always exactly the same exact REM sleep or deep sleep. Um, but the trick is to be able to make that useful information. And now there's, as you mentioned, only been since 2009 the first kind of real consumer wearable like the Fitbit. Now there's hundreds, from wearables to patches to Internet of Things to smart pill boxes. And I found the challenge of there's so many of these out there now that can be useful as a clinician or as a patient. How did I make sense of that? So I got the website domain digital.health. So if you go to digital.health, we now have a database of over 3,000 digital health solutions. Some of them are wearables, some of them are a connected inhaler, some of them might be a next generation continuous glucose monitor, or places you get full body MRIs, or a software that helps you run your medical practice and do smarter billing or communicate with patients. There's just a lot of solutions already out there in the broad digital health space. So I would encourage you to go to digital.health. Try that out. It's free. You can log in and even make your own formulary of devices you might and solutions you might want to use for your patients, and even have a digital prescription pad. So we're trying to build that early kind of model of like, you have a formulary for your antibiotics. Now you need a formulary for your digital solutions. Some of them are digital therapeutics. Might be a video game for ADHD that's FDA cleared, or it might again be a wearable device. The next generation of these type of things will probably also do blood pressure and even blood sugar. And that'll be something super useful for clinicians, not to look at every blood pressure number, but to see from baseline, is someone changing? There's something going on your sleep data that indicates that someone is getting COVID or is a high risk of a stroke or some other event? So
Right.
an exciting time to start connecting these dots. And for clinicians out there, when was the last time you prescribed a wearable? It might be a patient going home from a total hip replacement or some orthopedic intervention. Are they walking more each day, as you might expect, and doing well? Are they walking less? If they're walking less, maybe you need to intervene. That doesn't need to be some fancy FDA cleared device. It just can be the digital breadcrumbs from a simple wearable.
Yeah, exactly. Well, like in orthopedics, they actually started embedding the trackers inside of the total knee or hip arthroplasty devices, right? So, and you actually can have a direct measurements of the, uh, you know, the pressure you're putting on, your weight gain, obviously, or not, right? So, as well as the amount of walking you have been doing or not, right? So yeah, it's kind of interesting times. And I know that you wrote an article for National Geographic's, I believe in 2019, 12 innovations that will revolutionize the future of medicine. So what's your favorite?
It's hard to have a favorite. I mean, I've actually
No family
National
children?
Geographic. National Geographic actually, they retitled the 12 innovations that revolutionize the future of medicine. And the point of the article was, it's not about any one innovation, but how you kind of combine them together. I think, one of my sort of, favorites now, which is, getting more and more magical, is, augmented, virtual, and extended reality. Now in this realm of spatial computing. So, virtual reality via a VR platform is almost becoming almost like the equivalent of a syringe. It's a vehicle for doing new forms of therapy. It could be putting on a VR headset for a patient who's got burns, and they can use that to go into a cold virtual environment, throw snowballs at penguins in a platform called Snow World. And it's super effective at managing pain, whether you're a burn patient or going to the dentist. We can use it for clinicians to do training. You can go into the VR headset. There's a company called Oso VR that's well known for allowing you to practice an orthopedic procedure with the new tools from a particular company. And they can show that you can learn faster and maintain that knowledge and have better outcomes, kind of like a flight simulator for clinicians. It can obviously be used to engage patients to show them their tumor or their disease, and they can fly through their heart, or get an appreciation of what's happening in hypertension in their body. So VR, AR, XR, now the ability to bring that and meld that into the operating room. There's companies, one called Augmented out of Israel, where the surgeon has the augmented reality headset, can sort of see through the body, fuse their MRI data, and be guided step by step through a spinal fusion procedure, for example, and make it faster, better, and use crowdsourced knowledge from thousands of surgeries. So those are a few areas that are kind of, fun and, can engage patients, clinicians, and can be useful in the operating room or in the clinic, or to train folks who are in Antarctica or on the space station.
Yeah, that's really amazing. So it's great for, of course, training of the younger physicians, as well as
and older physicians,
maintaining skills. Yes,
yeah.
yes, and it's really interesting with the augmented reality. Almost feels like we're using the feedback, mechanisms, so to for pain, as you said, or ADD. So it's quite surprising. So I was not aware of that. So yeah, and what do you think of digital tattoos?
Well, this is the idea that your skin can be a biomarker for your sweat, for example, this idea of sweatables. And so there's a variety of sort of prototype tattoos, some of which can change color based on your blood sugar. So if you're a type 2 diabetic, for example, it might show if you're low, medium, or high, because you don't necessarily need to know your exact blood sugar. Some purport to be able to maybe even have a bit of a digital screen on them that could communicate instead of having your own, smartphone or other screen. Sweat can again be a biomarker that might be useful if you're running a marathon, or if you have renal disease or congestive heart failure. So we'll probably see some elements of those be useful in a variety of modalities. And again, I think it's not about any one wearable or data stream, but when you combine them together, where you can get really good insights and see when an individual patient has a change in baseline over time. My Apple Watch, or my Oura Ring, I've got data going back multiple years. One small story about virtual reality: early in the pandemic, when the gyms were all closed, I spent 100 days doing virtual reality workouts. There's an app called Supernatural, where you put on the headset, you're on a mountain, you have great music, there's a coach, you're whacking balls, and you get my heart rate up to 160, 170. And I could show my resting heart rate based on my Apple Watch data went down like 9 or 10 points over those 3 months that I did 100 days straight. So we can start to quantify these things, and VR can be a way of engaging folks in exercise as well.
I want to discuss with you a little bit the gene editing or CRISPR technology for organ transplantation using xenografts. Since now we know that we have a shortage of organ donors, so which is, I guess, a good thing. But tell us more about the CRISPR and because I know you communicated with the George Church, the Harvard lab guy on the xenografts. And
Well, we're still in the early era of true gene editing, but it's moved very quickly. It's only been 10, 11 years since Jennifer Doudna and colleagues kind of discovered CRISPR. They won the Nobel Prize, way to edit genes, and now getting more precise. And there's others. There's base editing. There's different versions. There's a new thing called bridge editing that just came out from ARC Institute in Palo Alto. So we're entering a new era of real gene editing, and last year was a big moment where the first approval for an FDA gene CRISPR-based therapy for curing something like sickle cell disease. Single base pair, take out the bone marrow, and I'm a bone marrow transplant doctor by background. Do the modification, do the bone marrow transplant back, and cure that patient of their sickle cell disease using their own modified blood-forming stem cells. So that's exciting. That's a form of transplantation. If you take it to the next level, huge shortage of organ donors, less people dying in motorcycle accidents because they're wearing helmets, as an example, but not enough organs to go around. So one potential approach is to take a xenograft, an organ from a pig. There's miniature swine have the same size organs as an adult. The challenge is the immune system would recognize that as a non-human heart or kidney. And what's been exciting is now using CRISPR-based gene editing that can knock out some of the porcine immune markers and knock in some human ones like HLA, so that they are much less likely to be rejected. And now we've seen the first cases early of heart transplants. I think the longest patient survived for a couple months with a xenograft heart from a pig, as well as some early versions of kidney elements. So that's still early days, but that might open up a whole new art of the possible. It may not be kosher to take the pig organ, but I think if you're on the wait list, you'll take it. And that's just the tip of the iceberg of potentially, taking tissues from other species and using them in smart ways. There's also thought about 3D printing, organs. It's harder to do. A bladder might be one thing, or a trachea, but a complex organ like a heart or a kidney or liver is more challenging. Some groups are repopulating. They're decellularizing a heart or a liver and repopulating it with healthy cells, and that might be another approach, even with lungs. So that's getting exciting. I think in the next decade, we'll see some real advancements there. So watch that space.
Yeah, no, it's a really intriguing field, I have to say. I mean, if we can really create a pancreas, replacing the organs, so to speak, for diabetic people, and not to deal with the organ rejection reaction, right? So, because those
There's a lot of exciting
medications
work in biohybrid devices. Can you take out your own, induce pluripotent stem cells, turn them into beta islet cells, put them back into the diabetic patient without them being rejected? Maybe they can go into the liver today, but they might eventually have rejected like their original ones. So folks are looking at biohybrid devices, a bit of an implant with a capsule around it or power. I was recently at an ARPA-H conference looking at biohybrid devices to think about what might come next in sort of little bioreactors you can put in your own body to cure type 1 diabetes, for example, or other applications, maybe a little GLP-1 pump for those of us who need to maintain lower weights.
And how did they achieve no rejection reaction with that?
There's a few approaches that have looked at encapsulating beta islet cells. It might be from a cadaveric donor, in which case there's often a rejection event. But if you can make your own iPS cells from your own blood cells and induce pluripotent stem cells into islet cells, put those back into a patient who might have type 1 diabetes, if you can turn off their immune response that they might have to the beta islet cells, they could end up with long-term cures and they respond to blood sugar and insulin appropriately, long-term cures for insulin. So that's coming closer and closer to reality at scale. And then another exciting piece might be doing, this gene editing in vivo. So, we talked about sickle cell disease and maybe taking out the cells from your bone marrow, modifying them in the test tube, and then putting them back into the patient. That's very expensive and laborious. What if we could do gene editing in vivo? So I'm going to zoom way back when I was a bone marrow transplant fellow at Stanford, do a lot of bone marrow harvest to pull out the bone marrow for often treating cancer patients. The marrow might come from a brother or a sister or an unrelated donor who's a immunologic match. And it's going, boy, this system's kind of silly. We're taking a big trocar, putting 100 holes in the iliac crest of the donor under general anesthesia to get about a liter of bone marrow, which is a life-saving form of cell therapy for often treating cancers like leukemia and lymphoma. So I invented a device called the Marrow Miner. You can go to marrowminer.com to learn more, which enables you to do a much faster, rapid and higher stem cell concentration harvest under local anesthesia, where you can pull out the cells. This is the flex shaft, we call it, of the Marrow Miner, so it can stay inside the hip, kind of like a bit of a rotor-rooter. So instead of taking an hour and 100 punctures, you could do it in 10, 15 minutes with just a couple punctures under local anesthesia. But this enables you to access the bone marrow cavity with this flexible rotating device. But we recently got a call from the Gates Foundation, doing work with University of Washington and Fred Hutch Cancer Center, interested maybe even delivering genes or cells into the marrow cavity. So you could do gene therapy in vivo. And if you're trying to treat a patient with, let's say, HIV or sickle cell, and you want to deliver the genes to turn off their sickle cell gene or knock out HIV, could you do that in vivo and maybe even as an outpatient? So we're now in the midst of doing a trial in non-human primates to see if we can get that to work. So from harvesting marrow to maybe ways of delivering things in the marrow, this little Marrow Miner device is one way to do that. And for your field, where in orthopedics and orthobiologics, we're looking at using this technology by orthopedic surgeons to physical medicine rehab folks who want to obtain bone marrow stem cells, often spin down the puffy coat and inject that back into joints for arthritic joints or musculoskeletal issues. It may be a useful tool to enable faster, better, cheaper, and higher yield bone marrow harvests to use for a variety of applications, from bone marrow transplant to gene therapy to orthopedic osteobiologic applications.
Yeah, that's fantastic. It's called Marrow Miner, correct?
The marrow miner, if you go to marrowminer.com, you can learn all about it. And if you are looking to use bone marrow, contact me.
Right. Yeah, no, of course, because it's a very growing field, obviously, so especially with the autologous, stem cell type of treatments for the orthobiologics. So, yeah. So we're going to take a quick break and we will be right back.
This podcast represents the personal views and opinions of the host and the guests and does not constitute medical advice. The statements contained in this podcast have not been evaluated by the FDA. Any products or treatments mentioned are not intended to diagnose, treat, or prevent any disease. And now your host, Dr. Irina.
So I wanted to ask you, Daniel, about the Next Med. So you are the chair and the curator of the Next Med Health. So it's a unique event that you've been setting up every year, I understand, right, in San Diego. So maybe we can get a little preview, sneak peek into this event that is coming up in December of this year, right?
Yeah, so the big picture, kind of the theme of what we talked about earlier, the most exciting elements of what's coming next in health and medicine is that this convergence of different fields. And we know as doctors, we kind of go to our siloed meetings. I'll go to the American Society of Hematology, ASH, or ASCO as in oncology, and you might go to orthopedic-related conferences. And then there's ones for pharma and med device and subspecialties. But it's kind of rare that you bring people together from all sorts of different fields across medicine, clinicians, technologists, investors, hospital systems, payers, startups. And so I was the chair of medicine for Singularity University. We noticed a lot of people were interested in technology and healthcare, but no one was kind of connecting those dots. So back in 2011, I started a program, which is now called Next Med Health. It was called Exponential Medicine for several years, where we bring together about 700 people from 30 countries to look at what's coming next, at the convergence of AI, robotics, 3D printing, nanotech, CRISPR, to psychedelics, to chatbots, to drones, to virtual and augmented reality. And so if you go to nextmed.health, you'll get a taste of that sort of program, which we do at a special place at the Hotel Del Coronado in San Diego. This year it'll be December 10th to 13th, 2024. And what's pretty amazing is we get a really incredible set of faculty from folks like George Church, who's been there before, to this year we'll have Rick Doblin on psychedelics, to Ed Boyden from MIT talking about next generation neurotech, to also from MIT, Hugh Hers building next generation bionic devices and prosthetics, to folks like Amir Dan Rubin, who was the CEO of Stanford Hospital System and then One Medical, who has the sort of investment and big picture perspective, to folks doing elements in the future of mental health, to regulatory, to public and global health. We'll have the former dean of Harvard School of Public Health as an example. So we bring amazing faculty together, but the magic of the community is you're learning from one big main stage, but then we do breakout sessions and deeper dives on the future of diagnostics or therapy or global health. We have an innovation lab with 60 selected startups. We have about 300 applicants, come down to 60 startups, from, kids coming out of a garage in Silicon Valley to a new innovation that comes out of Africa. So you see things early and get to try them out. And so the magic there is getting folks together to get out of their common mindset, see what's cutting edge, but what's going to be here in the next 2, 5, and 10 years, and what are the implications for their practice, for their hospital system, for their technology. A lot of folks meet, their future co-founders, partners, funders. If you go to nextmed.health, you'll get a taste from prior programs, but encourage folks to apply to join us this year. It's kind of been a labor of love, but it's always magical to see the sparks fly and people get inspired and to kind of see what's already out there, and let alone what might be next. So we had, I think in 2016, we had Moderna there talking about mRNA before anyone knew anything about mRNA as a therapeutic. We had companies like Livongo there when they were baby companies that then were sold for several $1 billion. We've had, early MAP studies on MDMA for PTSD. So you get to see what's coming next early, and also cross-fertilize with others who are trying to create the future faster.
Oh, this sounds a really remarkable event. So, and it's open to public anywhere, right? Anybody can register, is that right?
Well, it's a little application process. We want to make sure it's not all pharma people or med device or oncologists. So, but it's not a high bar. If you go to nextmed.health/join, fill in a 2-second application. We'll then send you an invitation to register and join us. And it's at again, at the beach at the Hotel del Coronado, the oldest resort in the West Coast, which is kind of a special power spot. You're not at a average Motel 6 or, Las Vegas Convention Center with thousands of people. It's a very kind of curated event and community. And we're going to, you can visit many of the talks online from past programs. But it's kind of that, and we're going to blend it into being more of a physical and a virtual event, and do, monthly virtual programs as well, and do deeper dives on particular topics. Because again, the magic happens when you get people thinking about what's coming on the exponential. How do you build your next generation solution so you're not stuck in 2020 technology, or thinking about fax machines as your communication platform, or what might you do with a $10 genome, or the new generations of proteomes, or what's coming next in a virtual reality or on your watch. So come join us.
Yeah, that sounds good. So we'll post it on the episode description, so the link. So it sounds really interesting. Yeah, and you've been also involved in the XPRIZE, is that correct?
Yeah, so the XPRIZE, for those who don't know, has been around for I think it was launched almost 30 years ago, with the idea that, inspired by the prize that instigated Charles Lindbergh to cross the Atlantic. He didn't go it just for kicks. He went to win a prize. I think it was a $10,000 prize back then, which is a lot of money in 1927 or so. And so the first XPRIZE was to get the first non-governmental rocket into space. That was the Ansari XPRIZE, a $10 million purse that ended up being won by Burt Rutan and team. And now that has spurred on the whole space industry, from SpaceX to Virgin Galactic to Jeff Bezos's Blue Origin.
Blue Origin.
So the idea is that an XPRIZE is, it makes things happen that are maybe not happening, but that should happen faster. I've helped run XPRIZes on a medical tricorder, the idea that you could be inspired by Star Trek and build a device that would help patients and clinicians diagnose themselves at home, kind of like the magic Star Trek tricorder. During the pandemic, I ran the XPRIZE Pandemic and Health Alliance, and we did a $10 million XPRIZE for rapid COVID testing, for fast, frequent, cheap, and easy COVID testing, something that did not exist in 2020, 2021. And we had 700 teams from, I think, 77 countries enter that competition, and some amazing innovations came out of that. Some have gone to market. Some are going to be helpful for diagnostics for COVID or infectious disease or non-infectious diseases. There's a $101 million health span XPRIZE that just launched last year. And we're always coming up with new ones. I help do the visioneering process. We might have a XPRIZE coming up for DNA writing, or for expanding the ability to have drugs anywhere, because there's drug shortages. So if you have ideas about XPRIZes, you can contact me as well. It's a great way to spur innovation, not just in health. There's been XPRIZes for rapid oil cleanups, and for carbon sequestration, and for rapid fire detection, and to help address environmental concerns. So that's the prize model. And I've been lucky to help lead the visioneering and steer the XPRIZE Health Alliance to bring and connect the dots to solve grand challenges through prize models and beyond.
That's fantastic. And what's the website for that?
You can go to xprize.org, and there'll be a listing of the current prizes and prior ones. If you Google XPRIZE Health Alliance, you'll find those, or the current Health Span XPRIZE, which is still open for submissions. And so it's what's exciting is it crowdsources folks, often from different fields, to solve for things differently. Often fields are filled with specialists. I think one of the examples was there was an ocean cleanup XPRIZE after one of the big oil spills, and the winning team was not from the usual set of folks. It was like a tattoo-parter artist and a design engineer and others. They came together, and I think the top 3 or 4 teams had solutions that were 2 or 4 times faster than any of the existing solutions, and the winning team was like 5 times faster and cheaper. So you end up with new thinking, new innovation, and the prize models. People spend a lot more than the actual prize purse often in solving for those. So incentive models can be a powerful way to go.
Yeah, that's such a fantastic way to innovate, I have to say. And I also wanted to ask you about quantified food. So I kind of tend to like that subject, because I do believe that food can be medicine. So do you have any insights into what's happening in that field?
Well, I mean, it's not a new idea as food is medicine or medicine is food. Hippocrates made that quote, "Let food be thy medicine, be thy food." And we know that especially our unhealthy foods drive a huge component of our disease burden and costs,
Right.
from diabetes to heart disease to neurologic disorders to risk for cancer. And particularly today in our processed food era, it's not great. And many of our our biggest fast food organization is actually school lunches, which aren't that healthy. And we know, putting on my pediatric hat, that, kids and their nutrition play a huge role in their downstream health and risk for mortality and morbidity. So I think we need to be much more proactive about our diets. And that ties to environmental health and exposures. But, a lot of folks are out there on fad diets, right? Is it, low carb or high protein or ketogenic diets? I think part of this future of health and medicine will be almost, a bit more precision nutrition based on your genome, your microbiome, your metabolomic data, because we all might respond a bit differently. Obviously, the GLP-1 inhibitors are starting to play a big role in metabolic health, and are hopefully going to have some big changes to, how many heart transplant surgeons we need, or how many bariatric surgeons are going to be busy, or how many folks need to be on high blood pressure meds. Just like we now have, electric cars, they don't need oil changes or new spark plugs. It's impacting the auto supply industry. Maybe we'll see some implications downstream that lower costs and improve outcomes. So nutrition's key. If you guys have small kids at home, there's some things you can do very upstream. There's data now that if you give a baby at 6 months, their first meals are often those Gerber white rice cereals, which are tasty and cheap. But white rice cereals as a primary diet ends up changing the microbiome of the gut of the baby, and they end up with much higher risks of early obesity and diabetes. But if you change that first meal into a whole grain cereal, that changes again the microbiome, the epigenetics of the kid, and they end up with much lower rates of early childhood obesity and downstream obesity. So small things you can do, particularly in the younger population, can have a huge role.
Yeah, so simple but so profound, right? So to the rest of people's life sometimes. So, and I guess my last question would be about your overall opinion about AI. So everybody is, of course, having their own fears or excitement about it. So, what do you think of AI and the future of medicine?
AI is
That's well said.
AI is not AI is not new, right? But back in 2011, right, there's all this hype about IBM Watson, beating the champions of Jeopardy, and we thought, 2 years later we'd have Dr. Watson. That was kind of that Amara's hype cycle. We thought it would be here faster than it was, but now 10 years later we have hundreds of FDA cleared AI platforms, particularly in radiology now, where they can really start to do, in many cases, a better job than the radiologists by themselves in diagnosing breast cancer to much more complex elements in pathology and beyond. So AI is really going to start to become more and more part of healthcare. It's starting now with not replacing your doctor, but upskilling and helping your clinician. We're often burned out by spending too much of their time typing electronic medical notes. Now it can listen to a conversation like ours. And if you are my doctor and we're having a conversation, it would start to write the note for you using AI-enabled transcription and synthesis of a note, so we can make the billing elements and sort of the note taking smarter. But then that AI can also read those notes from the past and read those labs and integrate all this data and sort of start to go, wow, this looks like a pattern that would be very hard for you as a clinician to put together in your head. We used to, as probably when you and I were residents, we do these chart biopsies. We get a whole stack of charts from someone's 20 admissions. You have to try and put that together. AI can start to find the needles in the haystack and already do a much better job than any of us in passing the medical boards. And we'll start to see this, play a role in health and triage and diagnostics and therapy and even drug discovery. So still early days. A lot of these LLMs still have hallucinations, but imagine what's going to be here in 5 years, let alone 10 years, when we'll each have, I like to call it not generative AI, but generative health. We'll each have our own personal health coach that communicates to us in our language and knows our culture and our incentives and our education level and what our health journey targets are, and can really help keep us on track with prevention and wellness, but nudge us to better behaviors or help us manage our acute and chronic diseases. So lots of potential with AI. It's still early days.
I'm actually looking forward to that, I have to say, yeah. And you mentioned the dictation services. Yeah, I believe that Google company created the special eyeglasses for the doctors that actually would be taking notes as a virtual assistant. And when
Well, that was
there's
Google Glass. You don't need
and
to be
they
in
are,
the glass. It can be on your phone today. And we're now going to start blending AI with robotics. So I have a seed stage venture fund called Continuum Health Ventures, continuumhealth.vc. We're investing in seed stage startups. One of them is a now advanced company doing humanoid embodied robots called Sanctuary AI. Very advanced finger articulation. It now can be trained to do things autonomously. You can imagine it being helpful in a pharmacy or maybe eventually in home care. We have a shortage of home care elements. Help with some nursing activities. Still early days, but the blending of AI and embodied technologies like robotics doesn't need to look like a human or a Big Hero 6 robot. But that'll be sort of exciting, particularly when there's not a lot of care, or you're blending AI and robotics in surgery. There's a huge shortage of big deserts where there's no surgeon who can do a simple breast biopsy or appendectomy in many parts of rural Africa or even parts of rural America. So we'll see these things blend and combine forces. And, just like when you fly across the world on an airplane, I'm a pilot. Most of what the pilots do today is just babysit the autopilot. We're going to see more and more autonomy in robotic surgery, and the surgeon will be there to kind of check in and guide it, and draw the line, and the suture will happen. So kind of like self-driving cars will get more and more autonomous elements of care. And there's lots of dystopian elements that might come along with that. All these technologies from AI to 3D printing to CRISPR and nanotech, you can now design a CRISPR-based virus to treat a cancer, but also maybe to make a bioterrorism weapon. You can 3D print a medication or a hip implant, but you also can 3D print a gun. You can use AI for good, and maybe it would have some bad. So we need to balance these guardrails as we have this exciting age, which is moving faster than we can keep up with in terms of regulatory reimbursement and ethics and business models.
Exactly. Yeah, as long as the ethics in place, I guess it's only a wonderful helper AI robotics can be to us doctors, as long as we're not gonna completely rely on them and became a little bit less clever, or will dull our
Well, to that point,
executive function.
Well, here's a big question. Number one, the question, what's the future of medical education? How do you train the next generation of doctors, nurses, pharmacists, physical therapists, et cetera, in this Gen AI age where you don't need to memorize everything? The differential diagnosis, It might be malpractice not to use the AI in the future for doing a diagnostic or therapeutic workup. But bigger picture, there's a quote from Sam Altman, the co-founder of OpenAI. ChatGPT is like an e-bike for the brain, right? It's great. It'll help you write your emails. It'll sketch something out. It can make you, write a musical for your kid with their name in it. Yeah, an e-bike makes things easier for some processes, even making music and writing poetry. But my pushback is, well, what happens if your kid never learns how to ride a regular bike or never develops their biking muscles? What's going to happen to the doctor who never learns to develop a differential diagnosis by themselves, without the help of the AI?
Right.
Kids today, I grew up on paper maps. I have some sense of direction, but my daughter drives with GPS. She has no sense of direction. What do you lose? You might use your brain for other things. We don't use slide rules anymore, or we still use calculators. But what are we going to lose if we start to rely on some of these tools, particularly if it changes how we get a good appreciation of being a good, well-rounded clinician or biotechnologist or anything?
Exactly. Yeah, and then what if there is an outage, right? So and we lose electricity. I mean,
Well,
who
that happened
do we
a few weeks
become, right?
ago.
So exactly.
The crowd strike thing knocked out a lot of hospital electronic medical records, and then the 50-something doctors like me who trained on paper, the heroes, they can still write a note, and the new residents like, wow, you have to write a note. I mean, so
a lot of people don't even know how to write cursive anymore. So it's so interesting to me, right? So even though there was a Princeton study that actually showed, your memory, your recall is much better if you actually write your notes, your lectures, versus, if you type them or, use the tablet of some sort with just, clicking, so it's really interesting how, our brain is designed. So yeah, we have to take all of that into account. Anyways.
Yeah, be careful that there's always a double-edged sword of technology. I have one of those, pads where you can write your notes and scribble them down, and it'll then translate it. It'll upload it to your records if you like to. It feels like writing on paper. That's a good way. I think, those of us who grew up taking notes, it does integrate with our brains more than if you just type notes. Or the AI is listening to your conversation and writes the summary, and then you never watch the summary. So I think we need to be thinking differently about, what's the future of medical education? Do you need to be good at, for the MCATs, at organic chemistry and physics, or do you need to have better emotional intelligence or better at video games if you're going to be a surgeon? What skills do we need? How do we do the future of CME? We all hate continual medical education. It's usually kind of bogus and filling out number 2 pencils and watching some video and answering a couple questions. But now you can go into a virtual reality environment and be challenged like a pilot on a flight simulator. I'm a pilot, so I love all those examples of, checklists and flight simulation and crew resource management that can improve patient outcomes and safety. How do we think about, when I started flying airplanes in college, it was, paper maps and round analog dials. Now my airplane has a touchscreen GPS with real-time situational awareness. The fighter pilots that I fly with, now they have heads-up displays in their helmets. So how can we bring that to clinicians and even patients? So you have real-time information that's helping guide you through a procedure or a workup or even a virtual telehealth call with real-time, just-in-time information, the weather, the traffic, the frequencies, the GPS map of health. And, imagine the future of medicine might be like self-driving cars. I had my first Waymo ride in San Francisco a few months ago. Press the button on the app, car pulls up, has your name on it, plays the music you want, gets you there. Well, what if healthcare was more like self-driving cars? It was on demand, transparent pricing. It adapted to the traffic around you and the weather based on real-time information, got you to where you wanted to go safely. And it was integrated, knew where all the other cars were on the road. So you can think about this in a crowdsourced future of medicine, real-time information, getting folks on their personal journeys, not the average journey, and making healthcare better and more effective for all of us.
Yeah, well, so well said. Well, thank you so much. You have been definitely at the forefront of transforming healthcare as we know it, Daniel. So yeah, what an interesting career you built for yourself, and appreciate your insights. And thank you for being here today.
Great to be with you. If you want to learn more, you can go to danielkraftmd.net, to digital.health, which has a whole set of those digital solutions, some of which I mentioned. And you can go to nextmed.health as a place to come and join a community that's helping catalyze the future of health and medicine for all of us.
That's great. Yeah. We'll post those as well in the episode description. So yeah, appreciate it. It was a very interesting conversation. Yeah. And thank you for joining us at Cures, Remedies, and Beyond, exploring science and the wisdom of health and healing. We hope to see you next time.